Welcome to the first day of our iCON Health Forum. Um, our theme for this week is going to be Take Charge of Your Health, Dementia 360. Please click on preview if you want to join the forum.
So we would like to acknowledge our iCON office is situated on the traditional ancestral unceded territory of the Musqueam, Swamish, and Skalleq peoples. I would also like to acknowledge that you are joining us today from many places near and far and acknowledge the traditional owners and caretakers of those lands. And there are a few announcements. First,
thank you very much. Thank you. I think that on screen you can, some of the participants have done this before, have joined our activities before, and today I'm just going to make a simple introduction of what iCON is all about. Hopefully that some of the participants will know. So the iCON is one of the projects initiated by the Digital Emergency Medicine of the Faculty of Medicine at the University of British Columbia. The main purpose is to help people in multicultural communities, including Chinese communities, understand how to prevent and self-manage chronic diseases by organizing health seminars, workshops, and using internet technology. We strive to share the most accurate and reliable health information with you. Not only do we hope that local people will actively participate in seminars and other activities, we also hope that the sharing of this health information can be extended to more remote areas and overseas through live webcasts and help everyone work together to improve their health. All right, first of all, I want to introduce from the lead of digital medicine, emergency medicine, and the founder of iCON, Dr. Kendall Hall, to give you a warm welcome. Kendall. All right, Barbara, thank you. Well, everyone, our friends online and the Cafe Nursing Home and the Mineral Community Center, we thank you for your active participation. I am Kendall Hall. I am at UBC. I am one of the professors at the School of Medicine at UBC, and I'm also the executive director of iCON. On behalf of the university and on behalf of the Ministry of Health, I thank you for your participation. And I know that it's been for 2 years that we've had this pandemic, so it's affecting us to the point where we have to do this online. I hope that in the near future we can sit together and then we can actively participate and know each other and know more information. And I know that today we thank you for your active and your enthusiastic support online, and then we can meet on the air. I know that there are some good friends, old friends, and there are also some newcomers, and thank you for your participation. I hope that today this subject on the talk of dementia, we can get some insights into this issue. We also thank many media partners. They help to promote this forum, and they're also exhibitors, health exhibitors, like Barbara said just now. Those you can visit within the next month. So every time after we have spoken, we will introduce 1 or 2 exhibitors to you. And we also are very thankful for the community partners. Today, I'm not able to thank them all, so I'm not going to thank them one by one. I'm very happy that at this point in time, I know that there are many speakers who will share with us their information, and I'm not going to delay that process. But before they do that, I am very honored to be able to invite the representative from the Ministry of Health in BC as Lindsey Scott.
I would like to invite Ms. Lindsey Scott, Lindsey Scott, who is the Director of Primary Care Quality and Primary Care Division of BC Ministry of Health. It's a huge pleasure to have her here join us today, and very kind to have her present to us opening remarks. So Lindsey, I'd love to pass this over to you, and thank you so much for being here.
Thank you, Kendall. Thank you for the opportunity to provide opening remarks at today's Chinese Health Forum, Take Charge of Your Health, Dementia 360. I'm Lindsey Scott, as Kendall said, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health. I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I'm located on in Saanich, and to the Songhees, the Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I would also like to acknowledge the Métis Charter community located in Victoria. Patients as Partners is based on the motto of nothing about me without me. We believe that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but is an effective way to make the health system better and the people of BC healthier. Patients as Partners has collaborated and funded iCON for over 10 years with Dr. Kendall Hall as the executive director for all of that time. When iCON started, they brought hundreds of people together to learn about managing chronic diseases. And over the years, iCON has continued to bring healthcare providers to speak to people in their first languages about topics people want to learn more about. This health forum brings together a number of presenters whose aims are to increase understanding of what dementia is and how to recognize it. Importantly, they will provide resources and strategies that you and your family can use to empower and optimize your quality of life. For me, today's topic is particularly important as my grandfather suffered from dementia. Having access to today's information and resources could have increased not only his quality of life, but my family's. I want to thank iCON for bringing us together today for this discussion, and I invite you to check out their resources after the discussion. Also, take a look at our patientsaspartners.ca website for other resources and more free educational events for patients and families. Again, I want to express a big thank you to our presenters today, and I appreciate your time and look forward to learning more. Thank you.
Great. Thank you so much, Lindsey.
Thank you again, Lindsey, for this opening remark and your support. And now I will pass the mic back to Barbara, and our forum starts now. Thank you, Doctor. Today, our theme is about managing health, Dementia 360. So you can tell that we hope that we can offer a series of topics on this theme to give you more insight into this issue. And there are so many things that we're going to cover today and tomorrow. For today, we want to recognize what dementia is and what the symptoms are and how the importance of early detection and when you will need to seek help and how to treat them, how to treat it, what are the medications to treat it, and how to how to interact with patients with dementia. And for tomorrow, there is another part of this. We're going to talk about nutrition for dementia patients and their mental health, as well as their home safety, as well as their long-term care. So when the patient will need to go into long-term care and also other care aspects, which we will leave for tomorrow. Today, we are going to have many speakers, and I'm going to give you a quick introduction. First of all, we have Dr. Charmaine Ma, who is a family doctor, who is a general practitioner. We are very happy that she has the time to come to do this talk. Dr. Ma was born in Hong Kong and grew up in Vancouver, so her Cantonese is absolutely awesome. And then we will have a very famous geriatrician, and I'm sure that many people have heard of Dr. Wong. We are very happy to have Dr. Roger Wong to help us talk about this he's going to talk about when the dementia gets serious, how to deal with that and how to treat it. And then we have a registered nurse, psychiatric nurse, Winnie Lau. Winnie has been with us for a few times and has done this workshop a number of times. She's a registered psychiatric nurse. She works at Vancouver Coastal Health for many years, and she is very enthusiastic about doing these kinds of fora to share information with us. And then we'll have a registered pharmacist who is Kent Link. Kent, he graduated from the Department of Pharmaceutical Sciences at the UBC and holds a Canadian registered pharmacist license. And he has done talks with us many times. And so he's very busy. Still, he has been very kind. He's very kind enough to take that time to talk about the medications relating to treating dementia. And finally, we will have Kendall Hall, Dr. Hall again. He will talk about virtual health, right? So that is because of the pandemic, you probably won't be able to see the doctor in person. And how do you interact with the doctor online? So what kind of equipment you need at home? So he's going to talk about those. So it's full of interesting subjects. So first we'll ask Dr. Ho again.
Okay, thank you, Barbara. So immediately I will introduce Charmaine Ma. She is a very good general practitioner and who is very good at diagnosing. I think she would get to explain a few things. So how we know the difference between normal aging and dementia. So sometimes I might have forgotten my glasses and then I may forget things. So would there be dementia? And also how to recognize early symptoms of dementia so that we can know the importance of early diagnosis. And also what factors would increase the risk of dementia. So what are ways for us to increase our help? So thank you, Dr. Ma. So we are going to listen to your presentation right away. So I'm Dr. Ma. Thank you so much. Thank you for your introduction. So I'm very honored today to share medical knowledge. I'm Charmaine Ma. I'm a registered family practitioner. And I hope that you will not forget the main topic. Today's topic is dementia. So actually what is dementia is actually a general term, but explaining that there is some changes in the nerves in our brain, and then it would go through aging faster than normal people, affecting our life and our function. So without further delay, I would like to talk about what are normal aging and then what is dementia. As a family doctor, many people would come to me and say, oh, sometimes I forget my keys. Sometimes I forget to bring my phone. Would that be dementia? But that is normal aging. So today, when we are getting older, so of course, then with certain age, then just like engines, we are going to wear and tear. And normal aging, well, occasion forgetfulness is kind of normal. For example, talking about past events for over a year or things for a significant time, then I think that is forgetting that is normal. And sometimes I might get lost occasionally. So sometimes we may not be going out for a meal for a long time. And then when I'm driving, we may have forgotten which turn we should make. So that is normal aging. However, if we find that our memory is getting worse, and even some very recent events we may forget, like just yesterday, whether I had a meal or whether I had my shower, or just last week, I saw a friend, but I have forgotten that. and also getting lost at places that you are familiar with. For example, a supermarket that you know of, and then it seems that you get lost. And then for some of my patients who've been here in Canada for many years, and sometimes you may forget which door is to the exit, so that may be symptoms of dementia. And also there are some unhappiness in life, which is very frequent, and that would affect our moods, and so that our moods will fluctuate. But from day to day, our moods should be stable. However, because of dementia, we may not have a good grasp of the time or the memory of events. Therefore, sometimes we may have unstable emotions. And some people would feel scared, some people feel angry, and some people may have a depression. And for most people, as we grow older, and we seem to be still very smart. And our conversation usually would be very clear. However, if you find that the conversation or even the speech is slurred, it seems that the ability of understanding and comprehension is affected. And these are some of the symptoms of dementia. And after all, on the whole, there are many things that can affect our everyday life. For example, shopping, financial management, and then as we get older, and most of these things we should be able to deal with. However, dementia would be affecting our everyday lives. So the next one we are looking at, we try to look at early symptoms. For early symptoms, so people may say, if it is really early, how can I differentiate whether it's dementia or some other symptoms? So first of all, when we talk about worsening of memory, so personally, the person may not feel it. So usually it would be people around us, friends or family. So for example, if you find that your family member seems to be forgetful and also losing the way in very familiar environments, then you should pay attention to it. And I would like to remind family and friends and try to raise the concern in loving care and concern. And if you hear people reminding you, then don't just try to hide away from the doctor. You try to approach it as soon as possible. And also the worsening of planning capabilities, for example, shopping, everyday lives, managing your daily life. If that seems to be problematic, that could be early symptoms. And also for everyday self-managing care, like eating or bathing, so then you should approach the family doctor. And talking about speech, if you find that the comprehension power or expression power is getting worse, then you should be paying attention. And we also talk about emotions. Some people would feel that very obviously. And because you have poorer memory, then that will affect your emotion, being fearful, angry, sadness, or even depressed. And also we mentioned in familiar places, you may get lost. And well, if you're among familiar people walking with family and friends, then you may not notice it. However, when you are on your own, then you get lost easily. That could also be early symptoms. Okay, and let's talk about the importance of early testing. As a family doctor, so my duty is to exclude other reasons. The reason why we have primary care, sometimes we would try to assess for the patients, because when you have discomfort and you come to the family doctor, we would ask you a bunch of questions and give you physical examinations. And then we can sometimes confirm that memory loss could be of other physical problems. For example, lack of vitamins. Some people would be lacking thyroid, and or some sleep problems will also affect memory. So whether you are depression or whether you are under the influence of alcohol or medicine, so that could also be affecting your memory. So it is good to bring it up with your family doctor as soon as possible. Another thing elderly persons should pay attention to would be your hearing or visual problems. If you do not hear well, then you might be misunderstood to have comprehensive issues. And if your vision is not good, then you may not see street signs and you get lost more easily, but not because of memory. And if we can have diagnosis of other health issues, then we can have active participation in your personal decisions. For example, including your health care and maintaining your health. There will be other specialists and pharmacists who can suggest other methods for treatments. And also, treatment takes time, so do not wait until the very last part of the illness and then to take care of it. So if you take care of it sooner, there will be more choices. And the importance of early testing, then you can set your goals more easily, like when should I be retiring, or should I be taking more trips? And also setting important decisions like legal or finance or healthcare decisions. So of course, these should be done as soon as possible. And therefore you can seek for support from other professionals like doctors, so that these could be done after early diagnosis, and then you can have more choices. And also you can also encourage other people too. You can promote research and things like those. The next one, we're talking about risk factors. Now, if you have taken part in previous iCON seminars, there are different age factors. There are some factors that are not changeable, and there are some changeable factors. And in this case, unchangeable factors will be our age. We discovered that people over 65, so maybe after 5 years or so, then the risk factor of having dementia will be higher. So for sure, age is a risk factor, but we cannot change it. The next one is about the genes. Although many people come in and say, oh, my immediate family or my extended families have dementias. That doesn't mean necessarily I will have it. So no, not necessarily. So just don't be afraid and just say to yourself that, oh, I'm doomed to have dementia. No, that is not the attitude. You should talk about this with your doctor. So to find out whether that genetic comes in play in your situation. So next, we can look at some changeable factors. There are some things that we can take charge of. As a family doctor, yes, I am nagging, I'm repeating. So I keep telling people that you should have a balanced diet and do healthy exercises. So when we talk about exercise, people will say, how much should I do? That is enough. In BC, health guide, there would be recommendations. So if you don't have restrictions, then there should be 150 minutes of exercise in a week. It sounds a lot, right? But what is the concept? If you split it up every day doing a little bit, then if you do 5 days a week, then every day you only have to approach 30 minutes. You don't even have to do 30 minutes in one lot. Say in the morning when you find that weather is good, then you can go out and have a 10 minutes walk. And in the afternoon, when you feel like it, then you can also go have a walk, do some dancing, do some swimming. And then these all come into play into the 150 minutes in the week. And tomorrow we are going to have a dietitian to share about tips on balanced diet. We discovered that some vitamin like vitamin D or B plus or folate. So if we are lacking any of those, that would also affect our brain health. And of course, there will be the 3 high or this smoking or alcohol because of the high blood pressure, high blood glucose, or blood cholesterol. They will all be affected, just like the water pipes in our home. If they have been used for a long time, then there will be some blockages. And therefore, if those blood vessels go into our brain and they are blocked, then of course that will affect our brain. And we also find that there is traumatic brain injury. For example, boxers or athletes who were more prone to have head injuries, then when they age, the risk factor of having dementia would be significantly higher. So therefore, some sports association, they are more stringent these days. Because even when young children have traumatic injury to the head, then there may be a further risk factor, and therefore they are trying to keep safety to a higher standard. The next one is about sleeping issues. If there is lack of sleep, then it will promote the deterioration of dementia. And nowadays, doctors are not prescribing sleeping pills a lot because some people may feel drowsy and that may affect your mood as well. And the next one, we are going to look at when to seek for help. When are we going to see the doctor? When are we going to see other professionals? So if you find yourself or those that you care that their habits, their speech, or their emotions seems to have a lot of change, then accompany them to the family doctor or even other specialists like nurses, pharmacists, to see whether they have professional suggestions so that you can have something to deal with it. And then when you discovered that the daily lives are being affected, that certainly will be a time to seek for help. And also, if you find that there are problems with care, and I think it is a good time to seek for help as well as to express your concern. And today, I know a lot of families are joining us. And if you care for your own health and you care for the health of those who are around you, and if you want to learn more, or you would want to search for more support, then you should take the first step and then to seek more information. Here, I would like to introduce some references. I know most people, before coming to the doctor, they would say, oh, doctor, you don't have to say as much. I have already come across a doctor who is more approachable, who is Dr. Googles. So some people, I tell them, don't go onto the website in the middle of the night and then look for those websites. Because usually when they come to the doctor, they will be very scared because they have read all those possible symptoms. So I have listed some possible steps. And I know that there is a recording as well as video recording. And I hope that you can find time to find what resources that you can find in the province of BC. And thank you so much to come to this forum to take care of your health. Thank you. So thank you, Dr. Ma. There is a lot of information. I'm going to introduce Dr. Wong. Actually, he doesn't have to be introduced because he's very famous. So he is going to explain to us the diagnostic process and the treatment and the treatment options. So I'm passing it to Dr. Wong. Okay, thank you, Dr. Wong.
Thank you, Dr. Hall. How are you, everyone? I'm very honored to be here to participate in this forum, this iCON Health Forum, from the Faculty of Medicine at UBC, and we hope that we can work together and after this talk. So Dr. Ma has explained in detail what is dementia, and I'm going to pick up on that and tell you about the assessments and treatments for dementia. Actually, you can tell by the name that it's about cognitive impairment. You've heard about Alzheimer's disease, and what are those things? I'm going to give you some simple explanation. So when you get older, it's a process. Of course, for the brain functions as you get older, of course, it's great to function normally. But in terms of memory, if you have issues, maybe initially there is something called mild cognitive impairment, MCI in acronym. So what is that? Actually, it means that maybe your memory is not as good, but your daily functions are still intact. No defects. But if your daily functions are impaired, and in that case, you may be suffering from dementia. Dementia is actually a very general term. There are many forms of dementia. I'm going to explain some of the common dementia cases. So there's this MCI mild cognitive impairment. So we know that this is one of the causes for one of the risk factors that cause dementia, but we cannot be sure that if you have MCI, then for 100% you will have dementia. Well, we haven't got to that point yet. However, we know that if you have MCI, every year there are changes. There will be deterioration, and there will be 10 to 15% deterioration. So for that, we want to know early, like Dr. Ma said, and I agree very much that seek help early, because if you can have an early treatment, you can have comprehensive assessment, you talk to your family doctor, you talk to a specialist like geriatrician, and if you suspect that you have MCI, and we can do some assessments. We have some standard tests. We call it MMSE, MOC, MOCA, something like that. So these are very basic standard tests. So when you see a family doctor or a specialist, you can discuss with them and see if you can have an assessment. Now, as far as dementia, actually, there are many types of dementia. The most common type is we call Alzheimer's disease or Asperger syndrome. Now, other than Alzheimer's disease, there is also the cardiovascular disease. There's also the Asperger combined with cardiovascular diseases. These are three common situations that take up about 80% of people with dementia cases. In other words, 80% of those who suffer from dementia, maybe they have either Alzheimer's disease or Asperger syndrome or cardiovascular disease. Now, the other 20% will be just, you have to consult specialists to have a assessment. Now, in terms of functional impairment, what's that all about? So we've heard that Dr. Ma has explained in detail, and I'm going to explain some more. So during the initial stage of a patient, some complex functions may be affected. For example, decision-making capacity, financial management, driving ability, cooking meals, and using a phone, or using a microphone, or when you buy a new washer, you don't know how to use it. So in terms of basic daily functions, if that also been affected, for example, changing your clothes, going to the bathroom, taking a bath, if you have difficulties even with walking, if you have problem even feeding yourself, that's more serious then. We say that, well, when you have a sick, seek help early and get a proper diagnosis. And those who take care of the patients that also has a serious impact on them. So those who have suffered from dementia, we have to know that we don't not only have to treat the patient themselves, also the caregivers around them, they also need our support. Now, actually, when we talk about dementia, other than poor memory, what other issues are there. So common situations, for example, you cannot recognize your relatives, your family or friends you haven't seen a long time, or you misidentify your siblings or even your spouse. Also, your focus, your concentration has difficulty. You cannot articulate what you want to say. You keep repeating yourself. And I'll give you some boost of confidence, So we say that even if you're repetitive, it doesn't mean that you suffer from dementia. So don't worry about it. What about some strange behaviors? For example, overly anxious, extremely anxious to the point where it affects daily functions. If you keep doing the same thing all the time, or your personality has changed, if you have been a very cool, calm, and collected person, now you become an aggressive person, or your family notice that, oh dear, this senior at home, he used to be a very mild person, now he swears a lot and he's very violent. So there's personality changes. And also if he gets lost, or if he loiters around, or he forgets to turn off the stove, forgets to turn off the faucet. So these are not normal situations, right? Of course, there's also hallucinations, hearing things that are not there, or incontinence, or poor appetite, or problem with swallowing. So you will have to consult doctors for those. Now, very simply, I am going to discuss with you a brain scan of someone who has dementia. This is not an MRI, actually. This is actually a brain scan. Now, this is brain scan. You can see that in this dementia case, the black areas shouldn't be that big black area. There should be some space. And in the middle of the brain, there are some gray white points that shows that this person has suffered a stroke before. So other than seeking early help, what does it mean? So seeking early help means that you have to consult your family doctor, or your specialist or geriatrician, or you have to follow up with the patient's medical history to give an overall assessment. And the most important thing is about functions. Are there impairments in the daily functions? So if there are, maybe it's mild MCI, mild cognitive impairment. If the impairment, the functional is serious, then it's dementia. So the way to deal with that, there are many ways. You don't have to use medications. There are ways to cope with that. You can use a notepad or use colors, post-it notes, or if you're worried that the patient is prone to getting lost, and then you can use GPS, and maybe you put that on your smartphone, download that on your smartphone to help those who are prone to getting lost. Now, the most important thing is to support the patient and to support the family. You have to do that early. So you can consult the Alzheimer's Society of British Columbia, or you can ask for help from them. And here in BC, we are lucky to have Alzheimer's Society in British Columbia. They offer services in Chinese and free services. You can call them from all over British Columbia and speak in Mandarin or Cantonese. And if the situation gets to the point where it creates a lot of stress to the family, so we think that would be very helpful. I know that today's talk and tomorrow's talks, you will hear that early intervention for patients to plan ahead, especially special arrangements, those things will be important as well. Now, during the pandemic, it's been almost 2 years now, and for dementia patients, there are many things that we can help them with. So this is there is the website from the Faculty of Medicine at UBC, and there are many articles which we can share with you all today. And the most important thing is, if every year you have not been vaccinated, you have not taken your flu shot every year, so it's time to take your flu shot because it reduces the chances of having to go to hospital and die, and doing more exercises. Even if you don't go outdoors, you can do exercises at home at appropriate times, because daily schedule, daily routines, fixed daily routines is important. Also, social activities, using different kinds of social media platforms. Yes, physical health is important. Mental health is also important. And of course, during the pandemic, we have ways in Canada to get vaccinations, and it's very important to get vaccinated. Most of my friends, most of the elderly people have had their 2 shots, and here in BC, we are getting the 3rd shot done now, so get your shots early. Other than that, we know that the music is also helpful, very, very helpful to dementia patients. Music therapy, for example, there are articles from the School of Medicine of UBC that tells you that music helps in terms of the moods of dementia patients. So whether you're singing or dancing or just or playing playing musical instruments, it doesn't matter. Now, as far as medications are concerned, here in Canada, in North America and around the world, there are many types of medications to reduce the progress, the deterioration of dementia. There are 4 kinds of medications here. There you can see those 4 types. Actually, those 4 types after the assessment, your family doctor, your specialist can make a decision with you whether to use medications to treat you. So here I will tell you that recently there is a very hot topic in the United States of America. There's a new medicine called aducanumab, which is a immunovaccine, antibody, and so it's a starch type of protein type of medication, and this antibody, monoclonal body, will it actually help the early dementia patients to reduce the progress of their the condition? We still await evidence to prove that, but in the United States, recently they have temporarily, FDA has approved temporarily this medications, but there are also research being done in other countries. We know that in terms of medications, there are always some new discoveries, new breakthroughs, and of course, still too early to make conclusions to tell you which medications are useful and which are not at this point in time. As far as the patients, caregivers, and family, what do they have to pay attention to? Well, as a geriatrician, I know that to treat dementia patients, you have also to care for their patients, the patients' families and their caregivers, because it could be very stressful. How do you help their caregivers and family to de-stress them? This is also very important. In September, I wrote an article. Which was published in Province, the newspaper. So if you're interested, you can look that up. And that article, there's also a Chinese translation, which you can see at the Alzheimer's Society of BC. And also there's information about the dementia. Actually, Success, some years ago, they published a book about the dementia, which you can also look up. And if you're interested in some seminars, TED Talks, I've done some TED Talks about how to help the elderly people with dementia to stay at home. So I thank you for your support, and I hope that it has been helpful. Thank you.
So let's go back to our presentations. And today I'm very honored to have Winnie Lau, a registered psychiatric nurse who is very experienced, to talk about management communication strategies for caregivers. So we are very honored to have Winnie, our psychiatric nurse. Yeah, I'll pass the time to you, Winnie. Thank you. So thank you. I'm very happy to come on to the iCON Health Forum so that we can discuss communication. So when we talk about how to communicate well with doctors or communicate well with the patient, and even among our family members. So first of all, we learn how to effectively communicate with family physician, just like when you go to see Dr. Ma or you see Dr. Wong. And most patients think that they are okay. They will say, well, I am okay. How come you take me to the doctor? It's you who have problem. Why don't you go? And sometimes we have difficulties getting somebody to the doctor. And for our service, sometimes the patient may say, well, why do you come to see me? I am okay. And sometimes we say, well, your family doctor is worried about you, so that they ask me to come and check you out so that we can report back to the family doctor. And that person who is bringing a patient to the family doctor, or we as the mental health team to visit the potential patient, then usually family members are present. And that person is very essential. That person is a key person. And we suggest there is one key person, a spokesperson. That is very important role to play because that person has to observe all the important changes or to keep track of all the questions for the family doctor, to take note of that. And then sometimes you have to present those in a very short period of time, because you can, as you know, some family doctors are very busy and you may only have 5 minutes to get through all your questions. And even for the specialists, yeah, the time is precious. So my suggestion is, before going to see the doctor, I think the family members have to sit down and do some sort of preparation, like doing some homework. For example, writing down changes in the everyday life. Changes in life would include the behavior, and then you have to write it down in details. For example, the person may all of a sudden open the door in the middle of the night. And then when you ask the person, why do you open the door in the middle of the night? That person may say, well, somebody is knocking at the door. Don't you hear it? Yeah, I hear somebody singing or dancing outside the door. So why don't you see it? And these are all examples of behavioral changes. And in this case, some people may have hallucination, and you have to note and write down whether this happens more often in the middle of the night or what time of the day. Another thing is about emotion. So if you find a person more agitated, or he seems to be a victim, and he is having very low moods, feel like crying. So these you have to note down for sure. Another thing, you have to write down physical health. For example, a fever, and people who have been having hypertension, and during that period of time, and I think most people have a blood pressure monitor. So within those weeks before seeing the doctor, take blood pressure more often, keep a record of that, and present the record to the doctor so that the doctor can make a clear assessment. And for example, if the patient has, it was the diabetic, so within those 2 weeks, make more frequent checks of blood sugar. Another thing may be sleep. And if you see the person is not having good sleep, then you have to check whether he is or she is more having difficulties falling asleep or getting up in the middle of the night. For safety at home, so you check whether the person is walking steadily, having any falls, or appetite. Would the appetite be affected? There are many reasons for affecting the appetite. So that's why within 2 weeks before seeing the doctor, you keep track of the body weight. Or if you have been having regular visits to the doctor, then at least you keep a record of the body weight, because sometimes the scale at the doctor's office may differ from the one at your home, so that you can keep track of the weight at home and then compare with that at the doctor's office. And the main goal is for the elderly to have good care and good service, and the person would have a stable life to stay within the household and reduce the stress towards the family members. Another thing we would like to talk about is how to communicate with family members living with dementia. I totally understand taking care of people living with dementia is really stressful and challenging. And then if to communicate with them, it is even more difficult. So usually I would suggest when communicating, make it simple. Speak slow, keep messages short. So don't keep your conversation too long or with multiple instructions, because the family member may not be able to understand. And sometimes they may be having different abilities in expressing themselves. I'll give an example. So after they have gotten up, they would put on a clothing and then brush your teeth and then go for breakfast. So if you start telling the person all these 4 steps, then it will be overwhelming. And the elderly would wonder, well, what is the first thing that you would like me to do? So why not stop, take a step back, and give short and simple instruction. So the time may be more lengthy, you may spend more time, but they can understand you better. For example, Mom, you get up. Okay, why don't you put on a coat and then take her to the washroom? When she is done, and then you tell her, well, why don't you brush your teeth? And after brushing the teeth, then you say, oh, let's wash your face. And after that, you take her to the dining room for breakfast. Although it takes time, however, the elderly would take in messages in sections, and then she will understand it very clearly. And for questions, so don't ask abstract questions. The best thing is to ask yes and no questions. Now, for example, so you may ask, oh, Mom, what beverage would you like to have this morning? So for her, then it will be difficult to make a choice. So in your mind, you may have her favorite drinks. So you can ask, would you like to have tea or water? And then it will be much simpler for her. And then she may come up with the idea and say, oh, let's have water. She not only understand, but she will not be overwhelmed by us by saying, oh, you're asking so many things and I cannot respond. And also try to make the environment quiet. I know Many of our elderlies may experience difficulties with their hearing. And then when they have a hearing problem and disturbed by background noises, then they wouldn't like to concentrate. And sometimes we bring a pocket talker. And just like what I'm doing right now, I'm wearing a headphone and then I'm holding the pocket talker, and they would be, it would be much easier for us to communicate with them. Of course, we would have good eye contact, and we may have cueing, and we may be holding a certain object so that they would know what we are talking about. And finally, which is important, avoid criticizing or arguing. So if you do that, so they will be agitated, and so would yourself be. And that will be a lose-lose situation. For example, if you say, every time when you go to the washroom, you forget to flush. I've reminded you so many times. Of course, they don't understand. They may forget everything after 5 minutes. They will be asking you every day, have I had my meal? What day of the week is it? So, well, forgetting flushing the toilet is really something challenging to them. So therefore, don't argue. So if they haven't flushed, just go in and do it for them. And then sometimes when neighbors have moved, then, well, if you argue with them, and they would think the neighbor has moved away. So if that doesn't affect anything in your life, so just accept it. Oh, really? Oh, the neighbor has moved. Okay, why don't we go out? Why don't we take a meal and try to forget it? So try to change the topic so that the person would not dwell on the same idea and being affected emotionally. So in that case, it will be a win-win situation. Okay, and finally, we learn how to navigate discussions about treatment with family members. As everyone knows, if there are a lot of siblings in the family, everyone has his or her own thoughts, and the caring strategies would be very different. So sometimes it will be quite challenging. So as Chinese people, we say, every family has their own stories. And therefore, on the whole, when we take back and think about this, so the most important thing is to allow the elderly the best service, the best care, and also respecting the concern and the wishes. And at the beginning of the stages of dementia, then discuss with the family member, what are your wishes down the road? And if you have the same ideas and beliefs, communication is usually easy. So in the old days, when the family members usually would have a logbook, and people would write down in the logbook what has been done. For example, bathing has been done and so on. And now with technology, everyone relies on the cell phone. And therefore we use the social media groups a lot, and that which is very good. For example, we can communicate in the groups saying, oh, I took my dad to Dr. Wong today, or I have changed the medication and I have filled the prescription. And through the social group, the whole family would know what is happening to the elderly. And then with a good communication, education is important. Just like today, when you join our forum today, or if you join in support groups, then even everyone knows what stages of deterioration of the disease may be, and even knowing all the methods of communication, and you know the supports that is offered in the community. But it seems that when you revise and then you revisit all these ideas, then you may be reminded. You may say, oh, yes, I have forgotten there is a method that we can use. And therefore, in those support groups, different families and members from different families can share their experience, and then they can have more support. And for example, my dad could be a mild dementia patient, but for the other family, the parent may have been in an advanced stage. And then by communicating, you can learn a lot, and you can bring it back to the family and share information with the family, and that will be superb. Finally, a lot of our elderly people cannot manage living in the household, and they have to go to long-term care facilities. And before going there, actually, the long-term care facilities would ask what are their favorites, what are their favorite goods, what food, what are their favorite activities. So their wishes would be for the residents to get used to the environment as soon as possible. And usually after 1 month, there will be a care conference, and they would welcome all the family members, not just the key person, but every family member to come to join the care conference, because their ultimate goal would for the residents to get used to the long-term care environment so that they can offer support to the residents. If you would like to learn more about long-term care, the facilities, and so on, so tomorrow, my colleague Miranda will give you lots of information. Thank you very much. Thank you, Winnie. And now let's go to the next speaker, Ken Ling, who is a pharmacist, and he has been cooperating with us, working with us for many years. And he is sharing his special knowledge on commonly used medications for people with dementia. So Kent, well, we are very happy to hear what you have to say.
How's everyone? I am a registered pharmacist, so I'm going to share with you some information about medications for dementia. Now, we've talked about actually dementia is a combination of conditions. There are many causes. Up to this point in time, medical research has not been able to find ways to cure dementia. Now, the treatment, the purpose of that is to reduce the speed of deterioration and also decrease the burden of the caregivers. So it's not going to restore your memory, your brain functions to where it was 20 or 30 years ago. It just wants to reduce the speed. And the medications address the causes for dementia. Actually, dementia, there are many causes. There are things like Alzheimer's disease or Asperger syndrome or stroke or cardiovascular diseases which cause dementia, or a combination of those. So that's like Dr. Wong said, take up about 60 to 80% of the causes. And a small portion is the dissemination of Lewy body dementia. So these also cause dementia. Now, everyone should know that cognitive dementia, medications for those actually is through to hope to keep the abilities, the cognitive abilities of the patients. So if we reduce the medications that are necessary, then you have dementia onset of it. And not all the medications are effective. So you have to get prescriptions from the family doctor or from a specialist. You just can't go to a pharmacy and ask the pharmacist What about giving me some kind of medications to treat my dementia, which I suspect I'm having? So you have to know about the medications. The doctors then will decide whether they will prescribe medications for you. Research has shown that these medications have only short-term effects. In other words, some patients, maybe since their 50s, they have the onset of dementia. And so research has shown that there's only limited effects for treating dementia. And there has been no conclusive studies that show that they have long-term effects to reduce the speed of dementia. They can reduce the speed, but in other words, they can delay the progress. But if you take it chronically, then the effect of the medication may diminish. So what is short-term effect? Now, so if you have, so if you take that for a few months, maybe you will find that, oh, your memory has improved a little bit, because these long-term effects also include reducing the speed of memory loss, and dementia can progress very faster or very slowly. Of course, you want to reduce the speed of its progress, but if it does progress fast, then it could affect your self-management skills, such as bathing and changing your clothes. So you may need your family or caregiver to help you, and hopefully that we can delay these things from happening using the medications, which will produce a lot short-term results. Now, of course, like I said, the effects are limited, and there are certain side effects. And a lot of times, because as you get older, you need to take other medications as well. So these medications may have an offsetting effect with other medications. So a lot of times, doctors will recommend that you set a time limit to take this kind of medication. It's not like you take it indefinitely for 20 or 30 years. And so it depends on the personal situation to see how effective it is. So it's not something that you should take indefinitely, or maybe at a certain point in time, you will have to change to another type of medication or to increase another medications. And dementia, lots of causes have to do with Alzheimer's disease or stroke. So these medications address Alzheimer's disease and Asperger syndrome. And so you need a doctor to prescribe them. One of those is, we call it acetylcholinesterase inhibitor. It's a pretty long name. So we can see that in Chinese it's also very long. So, so it is acetylcholinesterase inhibitors. Now, which is easier, Chinese or English? I think English is easier because Chinese is actually not something that you see every day. So, but you can break down the word. So acetylcholinesterase is something that decomposes, inhibit the decomposition. So it enhances the concentration of acetylcholine. So you reduces the density, and this medication suppresses this enzyme. So if you depress something that can dilute the acetylcholine, then that element in your body will increase. So through this decomposition, it enhances the concentrations of acetylcholine, and which slows down the decline of cognitive function. However, this medication cannot prevent your brain cells from being damaged, because as you get older, your brain cells may be damaged gradually. It can only prolong or delay the damage to brain cells, and to the point where there is not enough acetylcholine produced by your brain, then even you take this kind of enzyme, this medication is not going to be effective anymore. So in this medication, there are things that we can buy in Canada. One of that is called donepezil, and the brand is Aricept, and then there's galantamine. The brand is Remina, and then there is rivastigmine, and the brand is Exelon. There's medical patch, which you can put on your body, and this is we're talking about rivastigmine, or the brand is Exelon. You can put on your body. It's a patch that through the skin it absorbs into your body. Now we've talked about this kind of medications. It has side effects. So all medications have side effects. So it depends on how serious the side effects are. But a common side effect or common side effects are like nausea, vomiting, or gastrointestinal discomfort, dizziness, headaches, poor sleep, or even muscle spasms. So some people who have taken this medication may be, due to these side effects, they have to stop this medication because it can affect your daily life a lot. Because if you have gastrointestinal discomfort, then you cannot eat and you cannot eat well. And so pharmacists, when we dispense this drug, we will tell them how to take it so as to reduce the gastrointestinal discomfort. A lot of times, doctors will start with a very low dosage, a prescription with low dosage, and gradually increase the dosage to a standard where it is effective, it's more effective, and it can also reduce the side effects. And some medications we call long-term appropriate so it doesn't kick in right away. It takes longer term to kick in your body. Maybe after 24 hours, it starts getting effective, and so as to minimize side effects. We have to watch out that there's called long-acting release capsules have ER extended release. Extended release means that it releases gradually. So during that time, do not grind the capsule. It can be effective in the long-term basis, because when we design this medication, the outside or the packaging, it goes into your body through the capsule for the coating. So if you break it down, so it's not going to be effective. So it's going to be, you won't have extended release effect. And also with the medical patches, there are less chances of having nausea or vomiting. But some people may feel skin allergy after using those patches. So you can consult your family doctor whether it's appropriate for you to use patches. Say if you have eczema, maybe it's not appropriate for you to use patches. Now, we've talked about these medications, other than having side effects, also may have offsetting effects with other medications. For example, if someone has irregular heartbeat or cardiovascular disease, so they should not be candidates for these medications. Also, those who suffer from peptic ulcer should not take the medication. There was a question asked earlier that about seizures. Why would the doctor prescribe me? Why didn't the doctor prescribe me medications to control that? Because this medication can can increase the chances of having relapses for those patients who have seizures. So those who have seizures, whether they are candidates to take this medication, it's up to the doctor to decide. So for those who have irregular heartbeat, they also may not be suitable candidates for that. You know that when you take the medication, so your body needs something to break it down, or so for example, your kidney, your liver has to excrete it out. So if your kidney functions or liver functions are not good enough, then you have problems with excreting that the medication. So that could be more side effects. So those who have kidney or liver diseases, maybe the dosage is lower than those who do not have those diseases. Compared with other medications, for example, and muscle relaxants, they may have offsetting effects with those as well. So there are antibiotics, for example, donepezil and galantamine. They may also have offsetting effects. So you can talk to the family doctor about this. Say if you walk into a walk-in clinic, if you suffer from a mild infection, you go to see a different doctor. The doctor may prescribe an antibiotic to you. Maybe that doctor is not aware that you are already taking other medications. So those medications, chances are that they have offsetting effects, or have conflicts with the dementia medications. So you should show whoever prescribes you medications the medications that you are already taking. Other than those medications that I've talked about, Dr. Wong has also talked about Mandarin. Mandarin is another group of medications. Research has shown that those who suffer from middle to late stages, they're helpful to them. But for mild dementia or Alzheimer's diseases, they may not be that helpful. Obviously, that helpful. But the Mandarin, they are suitable for those who have middle or late stages of Alzheimer's disease. Well, how do you know? Well, you have to ask the doctor to give you the diagnosis. Some people, because I've told you that donepezil and other medications may cause peptic discomfort, or maybe that medication you cannot tolerate the side effects. So maybe the doctor will change to another medication that is Mandarin. The side effects of that is milder. Maybe you feel dizzy or constipation or headaches. But if you have high blood sugar, you should be careful. You can take that with food or without food, but those who have liver or kidney diseases, they are not suitable for candidates. Now, other than taking medications that can reduce the progress of brain impairment, some doctors will also prescribe some antidepressants or medications to stabilize your moods, or sedatives. When you say, oh, I only have dementia, how come you prescribe me those medications? I don't have mental issues. Actually, because of dementia, I mean, chronically, the patient may also suffer from depression. Maybe the mood changes will dictate that the doctors prescribe such medications, and that shouldn't be a problem. So they could effectively alleviate these problems of cognitive impairment and mood issues. So other than taking medications, is there another type of treatment? Say if I go online, Google, and consult Dr. Google, I found that there's ginkgo biloba, and there's also vitamin E or some anti-inflammatory medications. Are those effective? Actually, there are no scientific studies to support their effectiveness. On the contrary, they may have adverse effects on your body. For example, ginkgo biloba, or if you have too much of that, that has adverse effects. Vitamin E is also something that you shouldn't take too much because your body may not be able to decompose it. So other anti-inflammatory medications such as ibuprofen may not be suitable. So if you take too much medications, maybe it will not be good for your gastrointestinal functions. So there are other ways to treat dementia and cognitive impairment. So if you need medications, then you have to consult your pharmacist. We also said that dementia is not entirely associated with Alzheimer's disease or Asperger's syndrome. For example, if you've suffered from stroke or some brain injury or cardiovascular diseases, it could affect you. It could cause dementia. So you need other medications to help you. And at the same time, you may be taking blood pressure medications or cholesterol medications or anticoagulant medications to prevent stroke. So when you get older or when you have suffered stroke, so other than taking these cognitive impairment medications, you should also be taking some other medications for your cardiovascular conditions. Actually, dementia, one of the symptoms of that is you are forgetful. Now, if you're forgetful, or if it's minor thing, that's fine. But if you forget to take your medications, maybe your other conditions, you will not be able to control your other medical conditions, and it could be dangerous. So when you have to take medications and you forget that, it is a really vicious cycle. So how do you keep remembering to take medications? I'll give you some tips. First, the most primitive way is to write that down on a piece of paper, all the medications that you're taking, and every day you open that notebook up, morning, afternoon, or evening. Sometimes you take 2 times a day or maybe 4 times a day. So you write it down. So if it's complicated, then it's more necessary to write everything down. So you can see that for breakfast, lunch, dinner, bedtime, you take 2 or you take 1. Yeah. So you can also store it in your cell phone, and you can also put it down in your, like this blister packs. You can buy that in drugstores. So it's a pack that where you can put the medications for the entire week in there, so you don't have to worry about forgetting it. So some people said, oh, some medications I take twice a day, some I take once a day, some I take every few hours. How do I differentiate? How can I remember all these details? Well, if there's such a case, you can ask the pharmacy to pack these blister packs for you for free. So you don't have to pay extra when you fill the medications. Though they can give you 4 packs each time for 4 weeks. That should be good for one month. So you don't have to remember every time, oh, when do I have to medications? Because whenever you have to take medications, you just pop out from the back and then you can take it. And the pharmacist will also evaluate which medications should not be taken with what other medications to avoid offsetting effects. So for today, that's all that I want to share with you. Thank you. Thank you, Kent. And the last talk that we're going to talk about is I Would Do It. And it is about...
So there are 6 points I would like to share with you. So I would like to ask Suzanne to help me with the PowerPoint. So yeah, virtual care. Many people before COVID and many people do not have any knowledge about virtual care because there was not a need of seeing doctors and nurses by internet. However, during these 2 years, over 80 to 90% of patients have experienced virtual care. And sometimes it's between the family doctors and the patient and nurses with the patient. And usually it's the phone. But many people are using computer, just like using Zoom. So this is what we call virtual care. So when we talk about dementia, how can we get hold of virtual care? So the first one is if you have the access to virtual care, then the patient should be sitting together with a family member to see the doctor. Because in that case, we can have observation on not only the person who might have dementia, but we also hear the report of the family on the patient's day-to-day life. Because if you only allow the patient to talk with the doctor, you may not be able to assess. Now, the second one, there is one thing we cannot do. So we cannot go through internet to take a listen to your heart or to take a look at your symptoms. So therefore, there are 4 examples, which is very important. If you have these devices, then it would be very helpful to us doctors who are offering virtual care. The first one is temperature. So if you say, oh, I have a fever, and the temperature is very important. And for patients with dementia, although the person may have dementia, and then if there is a fever, there may be inflammation, and then it would make further deterioration of dementia. And therefore, we only think of the general situation, and also we would consider whether there is inflammation or infection existing in the patient. And if the family member can take a body temperature, of course, there are thermometers, and there are new devices like this one, which you put on the forehead, or you have an electronic thermometer and facing in front of your forehead and or into the ear, and the temperature can be taken. And this is our hope, that you have a device which can detect your body temperature at home. The second one is about blood pressure, which is very important. And we talk about the 3 highs. So this is one of the highs: blood pressure, sugar, and blood lipids. And for virtual care, because we don't have access to the patient, and having such a blood pressure monitor is important. And I hope your household would have that. I would like to introduce this website, hypertension.ca. Why do I recommend this? Because on hypertension.ca, there are recommended blood pressure monitors, because you can go to the pharmacy and you see different monitors. But there is one in gold color. You can see the gold check, and you can see different monitors which are being recommended. And for those having the gold tick, those would be recommended by the website. And the third device would be about heart rate. Very often, doctors would like to know the heart rate of patients. And during virtual care, the doctor may ask, well, what is your heart rate? And some people know what to do. They may put their fingers on the neck or on the wrist. However, some people may not know how to get a hold of their own heart rate. And sometimes because the heart rate is too fast and it's difficult to really accurately count that. And if you have a device to help counting the heart rate monitoring, and just like nowadays, there are some health watches, then it's very helpful. And if you don't have that, you can download an app. And this is one of them. This is free heart rate. And if you go to the app store of your phone, and if you download this app called Heart Rate, then by putting your finger against the light, your heart rate will be monitored and taken. And also, you can also see not only the rate is 86, but you can see all those waves. So representing the rhythm. So see whether the heart rate is regular. And sometimes even for virtual care, and if the patient has downloaded the app, then I can see from their phone not only the heart rate, but also the rhythm. And the next one, this is not as common, but I do recommend every household to have one. And this is to indicate the oxygen saturation. This is important, especially when people are having fever, infection, or pneumonia, and then the oxygen level would go down. So normally 98% or above is good. And sometimes when the percentage drops, and it may affect the ability of thinking. So this does not mean that person is having dementia, but affected by the lack of oxygen. And I know many pharmacies do sell this kind of devices, but they run out very quickly. You can go on Amazon and then you can purchase them. And if you do purchase one and have one at home, this is a good protection and be very helpful. And nowadays, there are a lot of watches that offer detection of oxygen saturation. But to be honest, it should be detected from the tip of your finger or the earlobe. And if it is detected on your wrist, it is not necessarily accurate. And therefore, I would not recommend taking the oxygen saturation by watches. And the last one talks about one-touch video conferencing. So sometimes when we do log in Zoom, there may be 2 or 3 steps. However, on the market, there is what we call the one-touch video conferencing. Once when you purchase that device, you just touch it for once, or when people call in, just one touch and you'll get connecting. You'll get connected, and then you can join in the conferencing. And for people having mild dementia, so it would be much less challenging to use such devices. And the last one, the 7th tips. There is one audience who asked a question. They said that for people living with dementia, there is GPS. How can we make use of GPS? Can we use it for people living with dementia? Because people living with dementia, they may be loitering or wandering, and they do not know the way home. And on the market, there are some buttons, or there are some tires, or there may be a little keychain or necklace, which can track the location